Okay. So I'm excited to be a part of this. My name is Ashley McClure. I'm a primary care internist and I live in Berkeley. So this is not, it's Sacramento Climate Week is a special event, but I'm coming in from the East Bay. And I co-founded Climate Health Now and work with Whitney as staff, part-time staff for Climate Health Now. And we're really excited for this event, talking about the climate, air quality, and health connection and how those are all connected and what it means and what we can do about it. So I'm excited to introduce our presenters. So Bill Pevec is a retired vascular surgeon professor from UC Davis. And then Ruben Alvero, who is a clinical professor of OBGYN and specializes in reproductive and endocrinology and infertility, also in Sacramento, who I got to meet actually in DC like 2 or 3 months ago. And then Goli Sahba, who's a retired family medicine and functional medicine physician in Midtown Sacramento. We can get into the granular local locales. And yeah, I really appreciate all the work that you all have put into making this presentation. And Climate Health Now has been, trying to connect more with the Climate Week event so that we can connect more to local kind of allies and, really anchor our work into a bigger audience. So glad to have you all. And the brief overview of our hour is we'll talk about particle pollution and health, why those are important and connected, and then air pollution and reproductive health. And then Goli will finish up with some opportunities for action that are very real, nothing hypothetical about those. So just a little bit about Climate Health Now. We're a organization, a 501c3 nonprofit that has members across the state, and we're really trying to bring members of the health community. So public health, clinicians, nurses, doctors, dentists, acupuncture, healthcare administrators, also anybody who identifies as working in health, bringing that health community that's a very big tent into advocacy for equitable systems level climate action in order to protect health. And most of our members have come to us because they feel like, taking care of one person in a hospital or clinic is totally inadequate in the face of, climate change and fires and heat waves. So we're really here to kind of go to the upstream work that we need in terms of policy to protect people's health. And at this point, we have about 970 members who are in the health community from, San Diego to Arcata, like up and down the whole huge Golden State. And then Climate Health Now is a 501c3 nonprofit. But because so much of our work is about policy and legislation, we also have an affiliated Climate Health Now Action Fund that's a 501c4 that is able to do the grassroots lobbying that we often do in Sacramento or with our representatives. So that's a little bit about Climate Health Now, and everybody's welcome to join. If you're a health professional, we welcome you joining. If you're not, we welcome supporters joining. So our website is just climatehealthnow.org. So I'll leave it at that, and then I'm going to pass it to Bill to share your slides. Perfect. We can see it. We might be able to hear you. Yeah, looks
Yeah,
great.
thank you. I was having a little trouble getting this started. Thank you.
Perfect.
So, welcome everyone. We're going to talk today about climate and air quality, and I'm going to start with an introduction. I suspect most of us are aware that burning fossil fuels contributes to climate change because when we burn fossil fuels, it increases carbon dioxide in the atmosphere, and that's led to increasing global temperatures. But it may not be as well recognized that fossil fuel burning also has significant and direct effects on our health. And particulates from particulates in the air from burning fossil fuels have been attributed to cause up to 18% of deaths worldwide, which adds up to almost 9 million premature deaths around the globe every year. And there's multiple different types of air pollution, multiple different components to air pollution. We're going to concentrate today particularly on particles in the air. Particle air pollution is a mix of many chemicals, and these can be either solids or liquid droplets, and these include inorganic ions, various metals, carbon, and organic compounds. And these small particles can be inhaled into our lungs. We typically talk about these small particles with two different sizes. PM10s, which are less than 10 micrometers in diameter, and that's compared to human hair, which is 50 to 70 micrometers in diameter. And the PM10s are concerning because they can get into the very smallest airways. The smallest particles we talk about are PM2.5s. These are smaller than 2.5 microns, and these are particularly worrisome because they're small enough to get into the bloodstream. Multiple different sources for the PM10s, including the burning of fossil fuels and wildfires and other wood burning. But PM10s also come from construction site dust, from landfills, agricultural activity, industrial pollution, and pollen. The really worrisome one, though, really worrisome particles, though, the PM2.5 particles, are primarily due to combustion of gasoline, oil, and diesel fuel, and wildfires and other wood fires. So the ones we really worry about are from vehicle pollution and from wildfires primarily. And just to give some idea of scale, this image is to scale, showing a PM 2.5 smaller than 2.5 microns compared to a red blood cell, which is substantially larger and almost 8 microns in diameter, although about 2.5 microns in width. And it's been estimated that about 44% of Americans, or 152 million Americans, live in areas with unhealthy air. And this is not evenly distributed. This is a map from the American Lung Association showing the average daily PM 2.5 pollution in the air in various states. And you can see it's not uniform, but it's particularly bad in the western half of the United States. And this is from the most recent reports. The American Lung Association puts out a State of the Air report every year. In the report of 2026, 11 of the 25 worst counties in the country are in California. So we have some of the worst air in the country. When I first looked at this report in 2022, California had 22 of the worst 25 counties in the United States. So our air in California is particularly bad. And this is looking particularly at Sacramento, seeing this is Sacramento Climate Week. And this is looking at the average number of days in the year that have high particulate counts in the air above what is considered a safe level. And the safe is considered 4 days per year by the American Lung Association. The most recent year, we were at 5.3 average days per year, which puts us above the line of failing or passing. So we got an F grade, but this is one of our better years. We can see over the last 2 decades, for the most part, Sacramento has been well above the line for number of bad air days. I looked up the acres burned in the state of California from Cal Fire over the last 20 years. I tried to see if I could find data specifically on Northern California to look at the Sacramento region. I could not find that, but this is a graph that I constructed of the acres burned in California by year. And if we compare this graph of acres burned to the bad air particle days in California, you can see those two graphs line up pretty well. So our really bad air days tend to be days when there are lots of fires burning in the state. But it's not just wildfires. This is the chart from the same report from 2026 from the American Lung Association, looking at the average concentration of particles. So this is looking at number of particles per cubic meter on average. And over the last 2 decades, we actually passed this year by the skin of our teeth. It's considered to be a passing grade if you have an average of 9 particles per cubic meter in the air. We scored at 8.9 for the most recent years, but this is the first time in 20 years that Sacramento has passed the average air quality. So we have bad air on average pretty much around the year. And that's because our bad air is not just from wildfires, but also from vehicle pollution. And the vehicle pollution makes our air bad year round. And any of you who have driven on either I-80 or I-50 out of the Sierra Nevada mountains down to Sacramento on a day that looks clear, the sky looks clear, the air hanging over Sacramento is always a horrible gray smudge. So even when we can't see how bad it is, if you look from a distance, our air almost always is bad. And a big contributor to that is that we not only get the exhaust fumes from the cars of the 2 million people or 2.5 million people who live in the Sacramento Valley, but we also get the exhaust from the 6 million or so people who live in the Bay Area. And that's because of the phenomenon that brings us the lovely Delta breeze. So the coastal range runs along the coast of California. There's a break in that range at the Carquinez Strait, which is where the Sacramento and San Joaquin rivers come together to form the delta and then drain into the the San Francisco Bay. Because of this geography, when the sun is hot on the valley, the air rises. When that air rises, it brings in the cool air from the ocean through the break in the mountains into the valley. That brings us a delta breeze, which is great, but it also brings us the exhaust from those millions of cars in the Bay Area, which get added to the exhaust from the millions of vehicles in our valley, leading to bad air year round. And this is the scale that's used to describe the air quality index. Many weather apps will show the AQI on your weather app on your phone. There's also a great website called airnow.gov that will give you the AQI for your region on an hourly basis. And a score of 0 to 5 is considered good. About 50 to 100 is moderate. Orange is 101 to 150, and that's unhealthy for sensitive groups. And then unhealthy for everybody is 151 to 200. Then once you get about 200, it's very unhealthy. And Goli is going to talk a little bit about what we can do when the air gets this bad. And this is real. This is from that site I mentioned, airnow.gov. And this was from August 20th, 2020. So that was when the LNU complex fire was burning throughout the coastal range, including Napa and Solano counties. And those of us who lived in Sacramento this time know that the air was terrible. And so this is red is unhealthy, purple is very unhealthy. You can see this is Sacramento here. We pretty much could not get away from this bad air. So we have to breathe. And when the air is bad, we've got no choice but to take in these potentially very harmful particles into our lungs and potentially into our bloodstream. And PM 2.5 particles in the air have been associated with multiple really bad health effects. This is from a review article published in 2022, quoting multiple studies that have looked at the harmful effects of PM 2.5 air pollution. And these harmful effects include increased rates of heart attacks, stroke, Alzheimer and Parkinson diseases, and reproductive problems, as well as other issues. And at this, I'm going to turn off my slides and turn it over to my colleague, Dr. Alvero, who's going to discuss those reproductive problems from PM 2.5 pollution in greater detail. Thank you.
Thank you, Bill. I'm gonna go over here. Ruben, I'm gonna do the best I can to intuit when you want to change slides, but just tell me next when
Yeah,
you're ready.
I can just tell you. Hi everybody. I'm Ruben Alvero. I'm a physician. I've been doing reproductive endocrinology for about 35 years at this point. And what that really means is that I help individuals and couples and so forth get pregnant and have a family. So what I'm going to be talking to you about is something that is actually relatively little recognize, even in our field, because the research is just getting started in terms of the impact of what Bill has been talking about at great length and excellent presentation that he just gave. Next slide, Ashley. So just a couple of takeaways. I like to kind of give, use some takeaways from sometimes these scientific talks get a little heavy, a little overwhelming. So I just want to kind of give you some of the basics. And basically, what I'd like you to take away is that the current impacts of a changing climate on air quality have impacts on reproduction. I'll talk very briefly about some of the definitions of reproductive outcomes. What I'd like you to know is that live birth just means that a child or a baby that's born live. Small for gestational age means that it's a baby that's smaller than expected. And then I'll talk a little bit about embryos, because one of the unfortunate aspects of what I do is that I actually have very granular, very microscopic even level knowledge about what happens to embryos and even eggs and to some extent sperm, and when the environment is not great. And of course, I'll kind of have you have some takeaways of the impacts of air quality on reproduction. Next slide, if you could. So Bill's, said this before, the particulate matter. What we're really interested in is particulate matter, 2.5. Now, there's a lot of things in air quality in addition to these small particles. There's sulfates, there's nitrous compounds, but the ones that are really concerning, and the data is a little bit missing, is the fact that particulate matter, as Bill said, is very small, and 2.5 in particular is so small that it's taken up goes all the way, you inhale it, goes to the alveoli, which is where air exchange happens in the lungs, and is actually taken up into the bloodstream. And from there, it goes to every tissue. Any tissue that the blood perfuses theoretically can get these small particulate particles. And so in my particular area, we're talking about what are the impacts of PM 2.5 in particular on reproduction, eggs and embryos and so forth. Next slide. Good. So Bill's already gone over the overall review in terms of what's normal, what's not normal. It's a little hard to say what's normal and not normal because the research is not as granular as we would like it to be. But as Bill has already mentioned, there's grades of normal to severe, and obviously severe is something that can potentially cause more problems. So this is a great article that one of my colleagues at UCSF did a very, very excellent review of reproduction and climate change, and in particular looked at PM 2.5. And conclusions from that talk were that PM 2.5 is associated with impaired both natural and medically assisted pregnancy. So natural, folks trying to get pregnant on their own. Medically assisted are things like intrauterine insemination, where we can take sperm and place it in the uterus at the right time of the cycle in order to have folks get pregnant. And also IVF is in vitro fertilization, where we create embryos outside of the body and put them in the uterine cavity. The findings were that early deliveries and small for gestational age babies were associated with were associated with bad. Did it just pop forward?
Sorry, yeah, I pushed
There you
the
go.
wrong.
Sorry. Yeah. Oh no, no worries.
You're back.
We're associated with worsening. So the worse the PM 2.5 levels got, the more likely that you would have adverse outcomes. And as we know, small babies don't do as well as babies that are closer to normal weight. One thing that's particularly concerning for us here in California is that wildfire tends to have very high PM 2.5 levels and can be as high. We'll look at a study today that was from Oregon, and it can be as high as 450 micrograms per meter cubed, and therefore has a greater adverse effect on fertility. Next slide, Ashley. Thank you. Now, how do we figure out what are these impacts? Well, there's a lot of natural studies that you can undertake, particularly in our field, and we're lucky that in many parts of China, which have very large populations that are being followed for reproduction, um, we can get some ideas of what happens when you have worsening air quality. And so this particular study was done in China. And this is a particular province where they followed the women trying to get pregnant very, very carefully. And in this study, 750,000 or more individual female residents were going up for preconception checkups just to see how we're doing, trying to improve outcomes. And yes, that's exactly right. Lots of air pollution in China. So this kind of leads to making this natural experiment a little bit more possible. And so not only could you assess what the outcomes were from these preconception as you followed these women from when they were trying to get pregnant all the way through to their outcomes in their pregnancies, and they could also track because they very carefully followed concentration data, and since they had the individuals' home addresses, they can actually get very excellent resolution as to where they lived and what their exposure was at a particular point of time. And in this particular study, which is probably one of the best that we'll find as a natural experiment in what happens in nature, for each 10 unit, 10 microgram per meter cubed increase in PM 2.5, and this is at the time that the woman actually conceived, pregnancy rate or tried to conceive, pregnancy rates were lower by 5%. So if women were trying to get pregnant and it turns out that there was a particularly high amount of PM 2.5 in that particular cycle, their pregnancy rates compared to those individuals who got pregnant at other cycles is lower by 5%. So clearly this has an impact. And it's hard to argue when you have such large numbers and such very granular data in terms of the outcomes. Next slide. So that was with unassisted folks getting pregnant. Now we're kind of getting into assisted reproduction, and this is one of my colleagues, Paul Amato, up in Oregon, who runs an IVF center at the University of Oregon. And so they looked at, and they had some wildfires back in this was 2023, I believe, if I'm not mistaken. And they were undergoing, these are individuals that are undergoing IVF treatments. And so they looked at what the PM 2.5 levels were, as well as other air quality index parameters. And then they looked at the time, both the time before when there was not a wildfire going on, and then during a 10-day exposure period while the wildfires were going on, as these women were going through IVF. The unexposed cohort consisted of these individuals that weren't exposed, and the cycles were at least 6 weeks before the wildfires. And bottom line, I'll give you the bottom line, is that the wildfire exposed patients had fewer embryos created, and this was statistically and clinically significant. Sometimes we look at things and they might be statistically significant, but they don't make a big difference in terms of actual outcomes. But in this particular case, it was both clinically and statistically significantly different. And also the wildfire exposed patients were more likely to have no embryos created during their cycle. So again, not a huge study, but a study that clearly showed that even with small numbers, you are seeing impacts on these folks' abilities to create embryos in order to try to get pregnant. Next slide. And this is another assisted reproduction. So this is IVF as well. And so this is a prospective cohort, again, in China, looking at 688 IVF cycles. They had, again, very, very specific data on where the patients lived. And they looked at PM 2.5 and overall pollution. They actually created an index, which is what you see in this little forest graph that we see here. And basically, pregnancy rates were measured. And so what they did is they compared the lowest quartile with the second, third, and fourth quartiles. And you can see that there's almost a dose-dependent effect, that the higher the PM, and actually this is not PM 2.5, this is kind of an index of overall quality of air, which includes PM 2.5, but then other measures as well. when you compare, for instance, quartile 1 and quartile 4, so the best that they ever got compared to the worst that they ever got, there was a significant decrease. And you can see it's almost dose dependent. The higher the air quality, the worse the air quality gets, the more likely that you have poor pregnancy rates associated with this, with these IVF cycles. Next slide. And then this is the last one, is in assisted reproduction, and this is in Australia. And bear with me on this one. This graph is a little bit complicated. And so basically what they did here is they looked at individuals who were going through IVF cycles. They looked at the air quality index and PM 2.5 while they were going through the IVF cycles, but then they froze the embryos. So they did an embryo transfer remote from the time that they actually created the embryos. And the bottom line here is, so if you look at that little box at the bottom, if you were exposed to high levels of PM 2.5, which is quartile 4, compared to quartile 1, which is where you had the low levels of PM 2.5, you can see that there's actually a 34% decrease in success rates when you compare the best air quality with the worst air quality. The other thing that makes this kind of important to note is that since the embryo transfers were done remote from the time of the air quality measurements, it looks like it's the actual, when folks actually create the embryos, or in natural cycles when they conceive naturally, that's the time that's critical in terms of the impact of bad air quality on reproductive outcomes. So next slide. So basically, these were some, there's lots of studies out there. I said that there weren't a lot of studies. There are studies, a lot of increasing number of studies, but these were kind of the best in terms of really delineating the outcomes associated with bad air quality and reproductive outcomes, both in terms of natural conception and also in terms of IVF cycles. So, and then the important thing is that during creation of the embryos or during the time of conception seems to be the worst time for fertility. Now, I didn't talk at all about things like outcomes like deliveries. That's a little bit outside of my wheelhouse, but my OB colleagues have also found that bad air quality close to the time of delivery is also associated with, like I said before, smaller babies that are born early, babies that have complications when they are born. So, the biggest takeaway from this is that, bad things happen when you have better air quality when it comes to reproduction. And we have increasingly, unfortunately, good data to support this thesis. And I think that's it for me. I think the next picture is just a picture of the Grand Canyon when there was a low PM 2.5 day. So yeah, there we go.
Clear skies, aren't they beautiful?
Clear skies. Yeah. So anyway, thank you very much for your attention, and I'm going to turn it over back to Ashley in our next section. Thank you.
Thank you so much. Thank you, Ruben. Yeah, it's amazing how consequential the air quality is for our families. Wow. Thank you I never had seen that level of data. So all the more reason to do the work that Goli is going to tell us about. So we are transitioning now from our C3 Climate Health Now content, and the rest of the time will be hosted by Climate Health Now Action Fund. That's our C4 sister organization that is able to do grassroots lobbying. So we're transitioning to CHN Action Fund, and then I'll pass it to you, Goli. Welcome.
All right. Thanks, everybody, for being here. And thank you for Dr. Pevec and Alvero for your great presentations. So I'm going to talk basically two areas. One, how you can protect your own health and actions you can take for your own health, because this stuff it looks pretty scary to see that we are being exposed to all this horrible stuff. And the second part is going to talk about how we can take a bigger approach to help stop and bring an end to the era of fossil fuels. That's
Woohoo!
yes, that's what we have to do as healthcare providers and as individuals. This is what we need to do. This is the goal that really we are set at this in this time in this place. We have to do this, being leaders in California. I'm sorry, I should say in the U.S. For the environment. They're just, I think that some of this information may be very simple, but I just included because I wasn't sure who will be there, and some people just are not aware. So two basic ways to, on a daily basis as you check the weather, you can just go to your weather app, or you can use airnow.gov. And this is an example, this on the right, where you can see, you can just say wherever you are, and you just put in your, where you are, and it'll just tell you where the air and what the air quality is. Next slide, please. Ashley, you're gonna, okay, thank you. All right.
There's a little delay.
No worries, that's fine. So this is my phone app. You can go there, and it has the time, the temperature and the chance of rain, but it also has the AQI right there, air quality index, and so it's helpful. But I'm going to go on to the next slide. And if it's over 40, depending on how much PM 2.5 you want to take on, you could wear a mask. Or just choose to be indoors more if your air quality inside is better than the outside. If you're in the range, in the definitely yellow, orange, red, or at least orange and red, you're gonna it would be great to use a 95 or not to go outside. Next slide, please. So what does the actual AQI measure? It's because I was wondering that, is it just PM 2.5? And apparently there's 6 things that they measure. This is a busy slide. It's really not meant for you to pay attention, other than the fact that this is based on the EPA recommendations to calculate AQI, and they look at the PM 2.5, PM 10, which are the larger particles, and then sulfur dioxide, nitrogen oxide, and carbon monoxide. So if any of these, whichever one has the highest level in terms of its safety, that's the AQI that they use for that day, that location. That's how. So if you have PM 2.5, if you look up, I don't know if you probably can't see my, because I'm not sharing, but basically that's if you just look at an AQI chart, you're not going to be able to tell what's the actual problem, but they do base it on whichever if any of these are higher than the healthy range, it'll say AQI is not good, and it'll have the color. Next slide, please. And then, so talking about, we talked about outdoor, air, being aware, and preventing the higher level PM or AQI exposures. But for indoor air quality, majority of our times, for most people, they spend indoors. And so we really have to pay attention to that. In doing this talk, I think I learned a lot more because I had not looked at our filters. So there's 2 main focuses for strategy to take care of your indoor air. One is we want to have active air filtration. Most of us who have a central heat and air, there's a place for a filter. And that filter, if you want to get the PM 2.5 out, you have to get MERV, which stands for Minimum Efficiency Reporting Value. If you ever wonder why MERV stands for, you want to get a 13. And this photo is the one it's like the first time I went and looked at my own, because my husband deals with all that, and I looked, and I'm like, oh my God, it's a MERV 8. So that means that all this time we have not been excluding PM 2.5 even on those smoky days. So it's pretty scary. So that now they do mention that you have to check with your HVAC system to make sure it can handle these higher filtration, or I guess it would be thicker. So you do have to check for that. And you want to also make sure you change your regularly. They recommend every 3 months, but I would say at least every 3 to 6 months. And then the HEPA filters, which we're going to talk about a little bit more, basically just stands for high efficiency particulate air filters. They remove 99.7% of particles anything bigger than 0.3. So they're very efficient, so definitely worthwhile. Let's go on. Next slide, please. So we talked about filtration, but also eliminating indoor sources. For a lot of us, we have really tried to make a difference. We've switched to electric stove, but lo and behold, cooking even on all stoves, you are generating PM 2.5, and that's really especially worse with higher heat cooking. This is a induction stove, and if you can see on top, there's an actual vent over it. So you need to use your vents even if you don't actually have a flame, because higher cooking such as broiling, frying, and grilling will actually generate these small particles that are inflammatory, and they cause everything that my colleagues mentioned. And then considering switching to electric, if you have a gas stove, but also all of the other equipment that we have, heat pumps, HVAC, electric heat pump, electric water heaters, and I would say clotheslines, but if you can't do that, then think about using, there's even a heat pump dryer. Next slide, please. And so let's talk about the gas stoves, which many people still have, especially folks who are in rental units. They don't really have control over those the appliances, and really this is a climate justice issue, because it's not just that, but also it's been shown that folks of Native American, Alaskan descent, they have a higher risk of these kinds of medical conditions caused by PM 2.5, as well as African Americans. And also the size of the house makes a difference. If it's a smaller house, these chemicals, which, everybody has one kitchen, they will concentrate in a smaller house. So that's also an issue. So what can we do about it? If we have gas stoves, you want to make, and they don't just have, they don't really just PM 2.5. We're thinking about these other pollutants, which I mentioned, the nitrogen dioxide, benzene, which is cancer causing, and other toxicants. And so a couple studies listed here. One showed that homes with gas stoves had 3 times the higher amounts of nitrogen dioxide than those with electric stoves. So significantly different, and it can make, affect our health. It also, one of the ways, because I had a friend who said, I don't know why I'm getting so many colds. I just don't understand it. And so I thought about it, and it's like one of the things could be because nitrous oxide can actually weaken the respiratory defense systems. They had not heard of a heat pump, electric heat pump. They have an actual gas heater for their entire home, not to mention their stove. So that's something to look at. And then we've all seen this this study that just kind of went crazy with the Republicans, Democrats fighting over, they're trying to take away our stoves, because it showed that 12.5 or 13% of childhood asthma is due to gas stoves. Also the other thing about gas, why to switch, is that it actually is 84 times as potent as carbon dioxide. So we don't want it. We can, as much as possible, we want to try to eliminate methane. Let's keep going, please. almost done with this part. So the other sources of indoor pollution, candles, incense, all the good things you got to get out, maybe do it outside. And also vacuuming with HEPA filtered vacuums, those do make a difference, but you've got to make sure that they are HEPA, because otherwise they'll release all the dust back up, and for a while it'll actually be worse in the house. Dry dusting is not recommended. You want to use a damp cloth. Removing shoes before entering can really help. And then portable air filters can make a difference. And on the next slide, this is just for your reference. I just brought it up for Consumer Reports. If people wonder, which one should I get? You maybe take a screenshot and you can use this in terms of, this was Consumer Reports did. Because I was looking for in PubMed to find actual studies on different, and I couldn't find any. All right, next slide. Now we're going to move on to collective action. So we've dealt with our homes, but we've got to help the planet. And so these are just some shots of the different actions with different groups that probably last year was the biggest thing we were working on. I work with Third Act Sacramento as well as Climate Health. Is this bill that we were trying to get passed, which is called Make Polluters Pay. It would develop it would charge the Cal EPA to assess the cost, how much each of the large oil companies have actually contributed to global greenhouse gas release, and it would charge them the fair share of their cost for generating this and causing the disasters that we are dealing with today. And this was a legislation that was already passed in Vermont and New York, certainly because of Vermont's all the floods they had, they were able to pass it. We were not able to get it through this year, but we have gotten multiple cities, counties, and even school districts to pass Make Polluters Pay resolutions to get this climate super fund passed to support it, and it will come back again next year. Next slide, please. And there are many groups, climate health, of course, but so many different ones, and we're often helping each other and connected. And it's, it may seem like it's more work, but actually to join together to do something powerful and connect it's really wonderful. I get a lot of satisfaction for working on this and then meeting people of all ages. So I highly encourage getting involved on this. Let's go on to the next one. Okay, so I'm going to talk about a few of the bills that are current right now and things that you can do about it. The most important one right now that we can actually use your help on is the one that's in red, but we'll talk about that. But these are the active bills in California that we're working on, different groups are working on. So I mentioned the Make Polluters Pay, and there's a couple other ones. So let's go on and I'll just talk about them individually. Okay, so I mentioned the Make Polluters Pay, and what's happened because Trump was elected by a large part by getting fossil fuel money to support him and the Republicans. Now they are asking for what they want for that, and what that is it's called we call it the no immunity for big oil. They have mentioned that their top priority right now this year is to get a legislation which would essentially give a get out of jail free card. This is at the federal level. Senator Cruz and let's see, Congresswoman Hageman from Montana have just brought this bill. And what this would do is, in effect, negate all the bills that people are working on right now to get, there's multiple lawsuits, as well as the two bills, the Polluters Pay that I mentioned that have already been passed in New York and in Vermont. And it would negate if California gets it. So we cannot let this pass. And so we had mentioned that this is an interactive thing. So besides the question answer time, I'm going to ask Dr. McClure to put this link So it's just a petition that will go to your congressperson and senator to say, if this, now that it's come up, please don't vote for this. Very simple thing you can do.
Yeah, I think, thank you for bringing this up. It's so important. I put the link in the chat. It's an Action Network petition. And then I think you put in your address and then it sends it to your your federal Congress member and 2 state senators.
Two senators, Padilla and Schiff,
Yeah.
Schiff, and then to your congressperson, whoever that is in your area.
Exactly. So let's all use it. And I guess the other thing I was going to mention that I find so appalling is that, we talk a lot about, oh, the link does not show the petition. Oh,
That's a problem with that platform. Their links never show the petition. And I don't like to sign things that I don't see what I'm signing. The Action Network never shows.
It should be it should be underneath.
I'll look again, but
I'm looking here.
Oh,
I think
there
it's
it is.
here.
Okay.
Yeah.
So this is the letter that would be sent.
Perfect. Thank you.
But what I found so appalling is that this is exactly what gun manufacturers did. I don't know in what year to prevent their liability. I mean, like, this is the dark forces. I'm reading Harry Potter with my daughter right now, and it's like, this is Voldemort's side right now in real life. So thank you, Goli, for bringing this up, because so important.
Absolutely. But there's more of us than them. And money's not everything. So we have power. While you guys are doing that, let me go on to the next one. Mm-hmm. Can you forward for me, please? This is a great one. This is, it's kind of like a small scale solar without all the installation costs and all the different issues that can come. Mainly the cost. It's like another appliance. You plug in your toaster, you plug in your little plug-in solar, and it generally can provide up to 20% of your electricity. It's great for apartment dwellers, people who don't have control over being able to get solar, or a lot of Sacramento elderly Sacramento's and low-income folks don't really even have AC. And as the temperature gets worse, we've got to do this. We've got to help with this. And what's nice about it, basically the bill is doing really well. Didn't have any no votes because there's no argument against it. The only people that would argue would be, I would say, the different utility companies that don't want stuff, and then they use the excuse, oh, it's not safe, stuff like that. But it has already passed in Utah. I think one other place, I think Colorado already passed. It's just legislation to say, hey, this is let's make it as simple as possible. So let's go on to the next one. This is not directly about oil and gas, but you can see what it will do. It's a bill to get a California state bank. Right now, California loses $8 billion every year it has to bank with Wall Street banks. And generally the top 4 Wall Street banks being, let's see, I get nervous. Let's see, Chase, B of A, Wells Fargo, and Citi. They are the largest funders of fossil fuels in the world. So by just doing the fact that if we could form a actual public bank, we would be divesting from them. That's number one. Number two, we could claw back $4 billion a year, which is really right now the deficit that we have in this country, in this state, I'm sorry, per year. And then just think about all of the needs that we have in the state in terms of climate action plans. So many of our counties and cities are in the red, and they just cannot afford, or they say they can't afford spending money on climate action. Well, the focus of these banks, because this is a movement all across the country, but in California, we're kind of ahead. We have in LA, San Francisco, East Bay, and Sacramento, and others. We have municipal public bank efforts going on, but this is also a state one. AB 2243 is getting a lot of support, and really the only people that are opposing it are the big banks, because it would not compete with the credit unions. It would not compete with your local banks. And yeah, it's a big thing happening, and it's very exciting. Let's go on to the next one. I'm sorry.
Is it okay, really quickly?
Yeah,
Goli, I
absolutely.
found, okay, so going back to plug-in solar.
Yeah.
I found the organizational support letter. So is anybody here associated with an organization like maybe Maria, CCEJN, maybe Harry with Sacramento PSR? Any organization you're a part of, if you could share, Naomi, UC Davis, I don't even know, if you could share this support letter. I put the link in the chat. It's about the balcony solar bill. And if they could consider, if they want to support it, then the more organizations that join on, the better, to just show the huge coalition that's behind it. So that's one really clear thing that would be very, very helpful. Because PG&E is, the utilities are second after big oil. So that support would be really helpful. So just to share that specific thing.
Thank you. That's great. Yeah, that's really great. All right, next one. There's also a bill to, this is by the Climate Center, which would, what they realize is that, when they talk about carbon capture and storage, which is just a way, it's just a way of basically getting oil companies to be able to continue to pollute. Whereas nature-based solutions, it's been shown that up to 30% of climate of greenhouse gases could be drawn with using proper techniques in California into the soil. So nature-based solutions, and this bill would actually help fund the projects that would promote nature-based solutions. A lot of it includes, wetland restoration, adding compost to the soil, doing the right kind of grazing, and 90% of California's lands can help store carbon. So it's a great positive solution. Next one. And that's with the Climate Center, that particular one. All right. This is also a great one. Around 1980s, under Reagan, they passed this giant tax loophole. It's the biggest tax loophole for oil and gas and other multinational corporations. They can earn the money here, but then claim it as, oh, it was earned in one of these tax havens. And so this would bring us back $4 billion a year, $3 to $4 billion a year, and that could really help, again, our deficit. And so that one's doing well. One of the hardest committees was the Revenue and Taxation Committee, but it got through it really well.
So I don't want to miss any opportunities. Here's the sign-on letter.
Good. I meant to do it for all these, but I wasn't sure how much. I don't want to run out of time.
I know. So that, so AB 1790, Connolly, that's the organizational sign-on letter. So maybe there could be two things, really concrete things that you could, ask to whatever organizations you're a part of. I saw Harry mentioned Sacramento PSR, and then Third Act. Like, each organization joining is a big deal. So that would be really cool. And this one is this is like the budget implications of AB 1790. Like, we need more money. So
we do. Yeah.
This is an easier sell than a lot of things. So and if you could package those, that'd be great.
Maybe what we could do is the follow-up from this, we could include these and then actually.
Yeah. And then Goli, we have about 3 more minutes. Just time check.
All right. Let's next one. I think we're almost done. Okay. This one is, I don't know a lot about this one. This is a recent one, but it's basically saying, let's not impede the progress of solar by putting a tax on solar homeowners. I don't know a lot about this bill. I just got it just came out. And next one, okay, so how can you guys take action? Join some of these organizations. And this was the thing that got me from just doing, working with schools and teaching nutrition and gardening to kids. When I read this article about Bill McKibben that said if we did everything right, each of us, got an electric car, got solar panels, everything right, it would not be enough. So he says we have to take this collaborative action so that we can change the laws. And that's why I encourage folks to get involved with whatever group you're interested in. We mentioned a bunch of them, but that's the only way we're going to change things. And then, yeah, and these are some of the actions we've had in the past. Dr. Wong is in there. We had a bunch of ducks. Yeah. That's it. Thank you so much.
Yeah, thank you. I love that earth on the gurney. It's awesome. So I think, let's see, we have upcoming invitations that we'll definitely share with everybody. But if we have time for a few questions, if anybody wants to bring their voice into the room. And thank you everybody for spending your lunch hour with us. And for our presenters, which did an awesome job. Is there any questions or comments? Okay.
I have a question.
Yeah. We'll go to Naomi and then Maria.
I think this is for Dr. Alvero. I think that so I'm at UC Davis. I'm an infectious disease doctor at UC Davis, and I think UC Davis is collaborating with some other UCs, I think, to study the health effects of the LA wildfires. And I was wondering if you know anything about that and like the reproductive health effects that they're studying, or if you're part of that at all.
No, I'm not actually, and I've heard of it, but I don't know much about it. I'm certainly not part of it. Um, we've been working at Stanford through so I'm familiar with Stanford, so we've been working closer with the planetary human planetary health to a lot of these studies. In terms of specific impact in my area on embryos, we have an embryo biobank at Stanford. So we're in the process of actually working with some of the folks at Human Planetary Health to come up with studies that will kind of do some of the basic science behind it. But actually, just to comment on the wildfires, one of the things that I was impressed with during the wildfires is how little reproductive discussion there was. All the things that were on the media were about, this family got out in the nick of time, or all the kind of the emergency exit kinds of things, but nothing about human health. And there was one about how women can protect themselves in pregnancy during wildfires. And other than that, it was even below the fold. There weren't very many things. So but yeah, no, so I would love to hear more about the Davis studies, if and see if we can maybe combine forces as well.
I I'm kind of not doing it as much anymore because I'm moving into healthcare sustainability, but I had been studying microbes in wildfire smoke because I'm an infectious disease physician, and I partnered with the UC Davis Fire Department. And so they actually have like a mounted sampler on their brush rig, which is the truck that goes out to fight wildfires. And they were deployed to LA during the fire, so they actually got samples from there. But I thought it would be really interesting also to study like the female firefighters and, long-term effects.
Yeah.
That's a good point. Yeah.
Totally. Yeah, I can connect you to if you want offline. So we're gonna go in the interest of time. I know everybody has other things, but we'll go to Maria's question and then we'll finish with Megan.
Hi, everybody. Good afternoon. My name is Maria Reese. I'm with the Central California Environmental Justice Network. So we're at the intersection of public health and environmental justice. I believe my director works with Climate Health Now, Cesar.
We love Cesar. Yes.
Yes, that's that's my boss. So obviously, I'm here because I'm listening, and obviously, like, this affects the community that I serve. The top, almost, I would say, more than half of the top 10 of the worst U.S. counties with year-round particle pollution are here in the Central Valley. So obviously, this is a really big thing for us. So thank you so much, first and foremost, to everybody that presented. I learned so much. I guess my question is, so on my spare time, I also volunteer with with a group of local medical students that are working here in the Central Valley. And I was wondering maybe potentially, so we just had like our annual conference a few months ago, but we're looking to, to start kind of like a theme for next year. So if y'all would be willing, I would love to have, anybody who's willing to potentially present to this group of medical students. It's a pretty diverse group of MDs and DO candidates. And they all have, an interest on how air pollution is affecting like their constituents that they ultimately will serve. So hopefully, we can connect at some point to see if that would work. Love to have you all work with us for sure.
Definitely. Yeah, Maria, we should connect and brainstorm about that. For sure. So let's do that. I don't know if I have your email. If you want to put it in the chat, I can grab it. And then but thank you for joining. And Megan will take your question and then we'll wrap up.
Yeah, I frequently get asked by women in the community, how is it that babies are born with cancer? And I am wondering if any of you have any studies that you've noticed um, in your searches about that subject, about if there's any pollution effects on a newborn being born with a cancerous condition.
I mean, I'm not aware of any, and certainly it's tantalizing kind of association, but it might be difficult to make that connection, without really big data. But yeah, no, and it would take large epidemiologic studies, and Bill probably is might be involved in some of those as well.
So many different heartbreaking moments, but I appreciate so much the conversation we had today and all the really different, super valuable, all interconnected perspectives. So happy Sacramento Climate Week, and to our presenters and to everybody who joined. So thank you, and stay tuned. If you go to climatehealthnow.org, if you're not already a member, you can join there, and that's the way to stay connected to the work that we're doing, which is in concert, with CCEJN and Third Act and all the other great groups. So thank you, everybody. Bye.
Thank you.
Thank you. Bye.